Hi friends, I'm Colonel Pradeep Pindyala, Professor of Anesthesiology at Ashram Medical College, Eluru city of Andhra Pradesh, India. Friends, I am going to talk about communication skills. I'm sure it will be very interesting and very useful. Please pay attention for the next 25 minutes. Here we go. So what is communication skills all about? Is developing strong communication skills is integral to becoming an effective healthcare provider. We are all healthcare providers. In recent years, good doctor-patient communication has been linked to improved patient satisfaction, better patient care, and decrease in malpractice lawsuits. It helps to diagnose and treat the disease better, to establish and maintain a therapeutic relationship. You have a better communication skill, and it does offer information, and it does educate ourselves as well as our patients. So what are the key features of good communication? It's interactive, dynamic, responsive, reduces uncertainty. It's planned and purposeful. And by the way, if you are doing communication with anybody, please welcome our feedback. What is verbal communication skills all about? It's providing structure. It does have a structure. It builds a relationship, initiates a session, gathers information, and does have better physical examination, explanation, planning. Closing the session is very important. When you're closing a session of discussion with anybody, make sure whether the person concerned has grasped, understood, and registered what has been communicated to him. Non-verbal communication, these are the body languages, eye gaze, eye contact, head movements, facial gesture. These are all important in communicating with the people. They do observe us, the body posture, everything matters, interactional. Space, gesture, hand, these are all affirmative signs. Do make contact with your body language too. What is this class? It's an acronym. C stands for context, the physical setup of the area to interview the patient. L is listening skill. Half the battle is won of learning better communication skills if you have patience and patientful listening skills. Listen, and listen genuinely. Acknowledge, validate, explore, and address emotions and concern. You must address the emotions of the concerned person. Strategy, it's a strategic maneuver, nothing. And when you are finally completing conclusion, summary, you must summarize what you have conveyed and make sure, look at his eyes, whether he has understood, followed, and registered what has been communicated to him so far. What is this context? Choose a physical area to have a private conversation. Always better to have private conversation with your patient. The patient should be seated closest to you. Eyes should be at the same level of the patient. Neither is up, above, or below. Present a relaxed demeanor. If you are relaxed, obviously your patient also will be relaxed and paying attention to what you're speaking. Maintain eye contact all the time. Only touch a non-threatening area like hand or forearm. Even that is better to avoid in places where there are cultural issues. You must know, even that small touching may be harmful in certain cultures. Listening skills. As I said, you should have patient listening power. You should have tons of patience. Allow the patient to speak without interruption. Nod to let the patient know that you are following. When you are listening, try to nod your head. There are time constraints and you want to leave the conversation, do tell him in beforehand that you have other appointment or time constraint, paucity of time or something. After taking his permission, do leave the concern. Acknowledge emotion. Empathetic response is very, very important. Nobody likes to be shown sympathy or pity. They would love if you show empathy. What is this empathy? Empathy means putting yourself into the shoes of the other person. Feel exactly what the other person is feeling. At the same time, don't start feeling anxiety if the person is feeling anxious. Identify the emotion, identify the cause of the emotion, respond by showing you have made connection between the emotion and the cause. Don't have the same feelings as the patient, as I just explained. If the person concerned is anxious, you don't have to become anxious yourself by showing your empathy. It's a plan, a praise or clarify with the patient their expectations of treatment and outcome. Decide what is the best medical plan along with your patient. Recommend strategy on how to proceed about. Evaluate the patient's response. If you have suggested some plan of action, one kind of surgery, one kind of treatment, see the response of the patients and their relatives. Collaborate and agree on a common plan along with the patient and their relatives. Explain them. Whenever you're finishing, summarize the discussion in a clear, concise manner. Check the patient's understanding. How much he has understood, how much he has registered, the language he understands the best. Ask if the patient has any other question for you. Make clear contract for a follow-up session. Encourage follow-up session and discussion. Emotional conversation. Be prepared, expect emotion. Have a plan. Monitor what you think and feel. Aim to turn a confrontation into a conversation. That's the skill, that's the magic of communication skill. A confrontation can be converted into a conversation, positive conversation. Know when not to have conversation and when to shut up, not to talk. That's very important. Eyes and ears should be open. You should be all ears for any discussion and when he's talking, but you need not talk all the time. Use non-judgmental listening. Prejudiced, don't be prejudiced. Remember, it's about the patient or the attendant. So be non-judgmental, especially listening. Maintain an eye contact, listen without interrupting, only making clarifying statements and paraphrasing. Avoid trying to make a situation better when it is grave. If you know that the outcome is very grave or it's a very high risk case, don't give the assurances saying that there's nothing going to happen, everything will be all right, God forbid anything happens, it's bound to react. So be careful. If in anger to patients or their families respond, wait for a few seconds before you react or respond. Be calm for a few seconds, then reply. Avoid being defensive and blame. Never be defensive. That means if you are defensive, means you have made some mistake. At the same time, don't be offensive and don't start blame game. From somebody has lost somebody's wife or brother or daughter at that time, don't start blaming him. He will react badly. He'll feel bad and bound to react. Acknowledge emotions by empathizing. I did mention, put yourself in the person's shoes. When emotion behavior escalate, you feel threatened, unsafe, end the interaction and leave that place. Better to be safe. Doctor-patient relationship. Patients do not fail treatment. Treatments fail to benefit patients. It's a very important thing. Most patients are anxious, fearful. Physicians should instill confidence and offer reassurance, but must never come across as arrogant and patronizing. Don't be bossy. You are a boss, there is no doubt about it, but don't show as if you are a boss. The doctor-patient relationship is in itself therapeutic. Half the thing is done and treated if you have good communication skills. Relationship of doctor-patient itself is therapeutic. A successful consultation with a trusted doctor will have beneficial effect irrespective of any other therapy. What are the types of doctor-patient relationship? The slide is slightly complicated, but within seconds, I'll make you understand every bit of it. Patient control, low high, doctor control, low default, consumerist, Doctor control, high paternalism and maturity. What is it? Paternalistic is like father or mother. Doctor plays the role of a father or a mother. Surprisingly, the patient derives considerable comfort in being relieved of burdens of worry and decision making himself. That is paternalistic relationship. Mutuality relationship is very understandable. A relationship of mutuality is characterized with the active involvement of patients, more equal partners in the consultation. Consumerist relationship, this should not be encouraged. A consumerist thinks that he's paying and he's the boss. So patient feels that he has an upper active role and he starts dictating terms. That should not be encouraged. The patient takes the active role and doctor adopting a fairly passive role because the patient is consumerist. Don't encourage that. The doctor accedes to the patient's request for second opinion, referral to a hospital, or write a sick note, and so on. Please don't encourage. What is this default relationship? For example, in an emergency situation, doctor is the boss. He is the final decision maker. At that time, in an emergency, don't start taking the patient's or the relatives' opinion because you should take the lead. So by default, you're the boss then, and you have to play dominant role. However, in other situations, patients can be more actively involved in treatment choices. Duties of good doctor. There's a lovely serial on Netflix. Do watch Good Doctor. Similarly, be a good doctor. You have to have plenty of knowledge, skills, and performance skills. Right now, you are participating in CME of ISACON National at Ahmedabad. That itself, that proves, that speaks volumes that you are learning extra knowledge, extra skills, updating your performance and skills. Make the care of your patient the first concern. Provide a good standard of practice and care. Safety, quality of healthcare is paramount. Take prompt action for patient safety as well as dignity. Communication, partnership, teamwork. Treat patients as individual. That's not a hernia patient, hemorrhoid patient. He's an individual. Respect him. Address him by his name, preferably. Respect patient's right to confidentiality. Don't start discussing his problem with his friends and relative when he doesn't feel comfortable about it. Patient's confidentiality is paramount. Work in partnership with patient, work with colleagues in the ways that best serve patients' interest. That means that your colleagues also should be in partner in patient's treatment. Maintaining trust, that's very important. Be honest, open, and act with integrity. Never discriminate unfairly against patients or colleagues. Never abuse your patient's trust. Very important. Barriers of good communication. What are they? Authoritarian or dismissive attitude. I have already mentioned. Bossy attitude is a barrier in communication skill. Hurried approach, a big no. Use of jargon. Don't start giving huge, heavy sounding words and medical terminology and jargon to a patient. Make him understand in the language he understands. Inability to speak first language of the patient, definitely a problem. Try to speak his first language, if at all possible. Learn it. Few important sentences and phrases. No experience of patient's cultural background is again will act against communication skills. You must have cultural background, knowledge of this patient. The patient's communication barriers are his anxiety, reluctance to discuss sensitive and trivial issues. He feels that's very trivial to be discussed. No, it could be important. Try to get that information. That will help you better history taking, better diagnosis, and better treatment. Misconceptions, conducting sources of information. Cognitive impairment, you must know that the patient is not as intelligent as you. Come down to his level, his frequency. He might have hearing, speech, visual impairment. You must know that. When two or more persons agree upon the same thing in the same sense, they are said to consent. That is Section 13 of Indian Contract Act 1872. Consent can be given by any person who is conscious mentally sound, and above 12 years of age. When a consent is not valid, if it is under fear, fraud, misrepresentation of facts by a person who is ignorant of the implications of the consent and is under 12 years of age. Depending upon the circumstances, consent could be applied, verbal, written, or informed. Conflict in workplace is very, very common all over the world, not only in India. Managing conflict in the workplace is a time-consuming but necessary task for the physicians for being a leader and good communicator. Conflicts may exist between physicians and staff, between staff and the patient and patient's family. Conflicts have an adverse effect on productivity, morale, and patient care. They may result in high employee turnover. The workers in the hospital start leaving the job, and certainly limit staff contributions and impede efficiency of your treatment. Disruptive physicians should be removed from your group. They are the people who are always negative thinkers, negative doers. They are the disruptive physicians. Don't be hand in glove with such people. Don't be sympathetic or empathetic with such people. Disruptive physicians. The communication should be direct and clear, with the subject not given an opportunity to respond until the end of the dissertation. However, individuals who have a destructive effect on the workforce should be asked to leave before they cause harm to you, your patient, and your reputation. Prevention of conflict. To prevent conflicts, a professional code of conduct should be established, not only in the hospital, but also as part of group policies and medical staff. Bylaws, ground rules make it easier to discipline. Everyone needs to understand that there are firm limits on inappropriate behavior beyond which it should not be accepted. Emotional intelligence or quotient, very important. For better communication skill. Emotional intelligence has been recognized as necessary not only to be successful leader, but also to be successful in life. That's very important. Emotional intelligence involves self-awareness, management of emotions, empathy, people skill, and motivation. The development of interpersonal intelligence allows understanding of other people. It helps understand and recognize your own emotions. Making control of those emotions would help you communicate better. Interpersonal communication. Communication in the medical act and active process of transmission and reception of information. In the medical domain, communication represents a fundamental clinical skill. The quality of the information obtained by the doctor during consultation is closely linked to the communication skills of the doctor and the patient. First, the listening must be active. Particular attention must be given to the non-verbal component. I said the body language. Adopt an open, patient, and calm attitude. Eye contact must be maintained all the time. Facial expression are monitored both by you as well as the patient and their relatives. Don't show a frustrated, unmotivated expression. Listener must be empathetic. Violence against doctors, a few words about it. No physicians, however conscientious or careful, can tell what they or are. He may not be the object of some undeserved attack and malicious accusation, blackmail, or suit for damages. This is a fact. Violence against doctors were once highly revered and respected by patients and the society as a whole. However, this is becoming extremely rare with advancing time. They are increasingly being subjected to verbal, physical abuse at the workplace. Moreover, the situation is worst in the world. 8 to 38% of health workers suffer physical violence. 1.6 million people die due to poor quality of health care, bad infrastructure. Highest rates of violence occurs in obstetrics and gynecology department, followed by medicine, and then next is surgery department. 75% of doctors face assault at the workplace. 70% of doctors feel unsafe while treating the patient. Very unfortunate, but true. Violence against doctors is not just confined to India, but it's a worldwide phenomenon. Acts of violence are merely verbal and physical and occur both in hospital and private clinics. What are they? Physical violence, mob lynching, that's the worst part, blackmailing, harassment by police and politicians, intimidation by gestures, cyberbullying, abusing verbally. Poor quality healthcare in the majority of government sectors, unfortunately. The negative image of doctors and the role played with the media. Poor socioeconomic status of the patient and with rising costs treatment which the patient can't afford. Poor communication, vulnerability and susceptibility of hospitals. Low awareness and knowledge of health-related issues by the patient. Violence against doctors, attack with the patient's relatives. You have studied for 10 to 15 years. Despite that, you have to face this. You don't have much personal, family and social life. You do have harassment by police, politicians, poor infrastructure. You have most government institutions, draconian laws and acts against doctors. Violence against doctors can lead to development of various types of psychological and psychiatric conditions in doctors. Doctors suffer depression, insomnia, post-traumatic stress disorder, PTSD, agoraphobia, that means fear of crowds and talking to many people. They fear agoraphobia after violence. Doctors themselves, fear and anxiety, often leading to absenteeism of work, loss of productivity. What are the warning signs of violence? Stamp, always remember the stamp. Staring, tone, anxiety, mumbling, pacing. These are the warning signs of violence. How are they? If the person is staring, he may act violently. The tone and volume, if it is raising, he may next be violent. If anxiety is coming to the emergency department, makes patients stressed out, he may act badly. Mumbling, they are dangerous people. Pacing of the relatives up and down, that means next he may attack you. With the rise in the mob violence incident, doctors are also becoming cautious, reluctant to take up serious. That's very unfortunate, serious and grave cases they are not taking up. This in turn compromises healthcare, which defeats the very purpose of the healthcare system. Very unfortunate. Knowledge dissipation. The general public should be educated about the various diseases and associated health issues, especially through media. This will generate health awareness and equip patients with knowledge that will be useful for them to make informed choices about their health. Strengthening of infrastructure in PSC and sub-health centers and rural areas are a must. This would significantly reduce the patient load on tertiary care. Hospitals. This will help to improve doctor-patient relationship. Studies have shown that effective doctor-patient communication is correlated directly with higher and better patient satisfaction in treatment. Workplace safety is paramount. A safe work environment and congenial atmosphere for doctors would significantly enhance their efficiency. Proactive media, please, media may be considered to be window of the society. It plays an instrumental role in bringing to light the happenings of the healthcare system in our country. Therefore, it is the obligation of the media to cover the positive news of the medical profession, not just the negative news, and should avoid sensationalism in the news. Please, they should also desist from media trials of doctors, which should be left to the doctors, not on TV channels, please. Security in government hospital is grossly inadequate. There is urgent need for more guards to regulate the admission of attendance of patients. Additionally, monitoring of CCTV should be made mandatory in hospitals. That would help. Political interference should not be encouraged. Politicians should refrain from interfering with hospital matters. They should also discourage the VIP culture, as many acts of violence on doctors are perpetrated by individuals having strong political connections. Strict punishment, there should be strict convictions and fast-track proceedings in courts of justice against violence against doctors. Medical Protection Act in PA has currently been implemented in about 23 states in India. Andhra Pradesh, where I'm working in the Ashram Medical College, that state, was the first state to implement the MPA in 2007. As per this law, any violence against doctors would be non-bailable offense. With a fine up to 50,000 and a jail term up to 3 years or more. Doctors' attitude. There is a need for a change in the attitude of doctors. Sometimes arrogant behavior, condescending attitude displayed by doctors. I said that bossy attitude lead to altercation. The role of medical colleges. Medical college can play an important role along with the medical subject. They should also teach communication skills. That's very important. Role of hospital, improvement of services, employment of adequate number of doctors, so that less long waiting hours are reduced. Use of computer, internet technology. The primary objective of the doctor is to listen to the patient in order to identify what is the real problem actually, instead of simply eliciting symptoms and signs. Shared decisions making between the doctor and the patient will determine the most appropriate, best course of action. Communication becomes increasingly more a therapeutic technique, a clinical skill that creates fundamental relationship that can provide benefits to those involved. The medical curriculum should include soft skills like communication skills. Both doctors and patients have a role to play in avoiding unnecessary violence. Thank you for patient listening. So I finished my lecture as promised in 20 minutes. Now it's your time to ask me as many questions as